Hi, this is Dr. Bill Schenck, Clinic Director and Wellness Expert at Vizuri Health Center in Williston, Vermont. Today I want to talk to you about healthy longevity. And what inspired this is that recently our oldest patient came in for her regular adjustment. She's 96 years young. And I just happened to ask her, I said, what medications are you taking? And I had a good idea. And she said, well, I just take one, and it's a low dose blood pressure medication. And which is pretty phenomenal. Most people by the time they're 65 are on a slew of drugs. In fact, the average senior citizen is given 13 prescriptions per year in America. That's phenomenal. Highest in the world, right? In fact, America consumes 75% of the prescribed drugs in the world, in a country that makes up less than 5% of the world's population. But that I detract. Let's talk about healthy longevity. How do you live a long, healthy life with vibrancy and get to be 96 and enjoying life and looking forward to the next day? Well, some people would say, well, it's in your genes, right? Well, genes are only half the story. You see, I say that you inherit two things. You inherit your genes, and you also inherit your lifestyle. So genes you have no choice about, but your lifestyles are entirely up to you. In fact, your lifestyles are what are called epigenetics, the things that are above genes. Epi means above. So those are the things that signal or inform your genes what to do. You see, genes are pretty passive. They just sort of wait around waiting to be signaled by the environment. And to simplify this, it comes down to really just three things. It's how you move your body, it's what you eat or fail to eat, and it's what you think. So let's talk about that in a little more detail. It's like movement. How much is movement? Well, if you look at the two extremes of movement, right? We know that being a couch potato isn't so good for you. We've known that. It's not good for you. On the other hand, someone that's an extreme athlete that takes it to the nth degree is also not so healthy. Those people don't live long, healthy lives. But people that stay fit, and particularly people that maintain their muscle mass, tend to have a longer life. So staying moving, and particularly doing things that build and maintain your muscle mass for both men and women is critically important. 2, eating well. There's a whole long list of things that I would say that you can include in this. That's way beyond this conversation. But think about foods as close to nature as possible, to have those on a regular basis. Have a salad every day that looks like a rainbow, as many colors as possible. But there's a lot of things you should avoid in terms of eating that are out there today. You have to be particularly careful about what you eat. And many of the foods that are advertised, that are actually inexpensive in the stores these days, have in it chemicals that signal your brains to want the same food again. They become addictive foods because the people making this stuff understand how the brain chemistry works. So you have to pay particular attention about what goes into your body. And the last thing, remember we talked about moving, eating, and thinking well to signal your genes. And it doesn't mean you have to be really smart or read lots of thick books or things like this or have a big vocabulary. It's really about handling your stress. And one of the things about this 96-year-old person is that she regularly gets a good night's rest. She goes to bed at the same time, sleeps pretty much through the night, and then gets up feeling refreshed every day. And so that rhythm of sleep is so important. So rhythms are critically important. Being able to handle and to mitigate stress on a daily basis, that's so important. So how do you mitigate stress? Well, exercise is very helpful for this. Journaling can help. Meditation certainly can help. Having a prayer ritual, reading things that are inspirational, and hanging out with people that are like mind. People that don't create a lot of stress in your life. People that support you, that love you, that encourage you. Those are so critical for living a healthy, long life. So remember, the three things that you're in control of is moving well, eating well, and thinking well. Those three things signal your genes, and you're more likely to set the stage for something that's called healthy longevity. Because I want you to have a long, healthy life and then die quick. Okay? This is Dr. Bill Schenck. Looking forward to seeing you soon. Be well.